Good evening and thanks for joining us. We begin with some rare good news about COVID-19 numbers in Canada. It appears tougher restrictions are having an impact. Overall, the number of Canadians testing positive each day has begun to drop. Ontario, for example, reported 1,670 new infections today, and that is the lowest daily case count since late November. Here is the picture across Canada, adjusted for population. The three prairie provinces, led by Manitoba, have the most active cases per capita, though case counts have been dropping there too in the last few weeks. Underlying those numbers, though, are some troubling indicators. Hospitalizations remain much higher than during the first wave, and more than 100 Canadians are still dying of COVID-19 every day. 165 deaths were reported just yesterday. Add to that the highly contagious new variants, and Canada is at a precarious point. No one knows yet how widely those variants are spreading. If they take hold, like they have in other countries, case numbers could explode. And Canada's already sluggish vaccine rollout is facing another hurdle. Pfizer-BioNTech wants Health Canada to stretch the number of doses in each vial from 5 to 6. The company says that change would help minimize vaccine wastage. As Abigail Bimman reports, it's not that simple.
This is a standard syringe.
When you depress it all the way down, in a lot of these, there's just a little bit of space left. You were never meant to inject that last little bit into the person's arm. It's just a bit of dead space.
And this is what's called a low dead space syringe.
You really do draw up exactly the volume that you need, and you inject all of it into the person's arm. Your measurements are a lot more precise.
Pfizer wants Health Canada to approve a change to its vaccine labels to show each vial has 6 doses instead of 5, and tells Global News while a low dead space syringe will work for 6, with a standard syringe, there may only be enough room for 5 doses. The U.S. Food and Drug Administration and Europe approved a similar request. In total, Canada has bought more than 145 million syringes. 37.5 million of those are low dead space ones, but by deadline, the procurement department wouldn't answer how many have arrived.
They're called a niche market, right? This is a type of syringe that we do sometimes use, but it's not commonplace. This is not a syringe that we would have expected to be planning for using. This really was a bonus.
Syringes or no syringes, we're short on vaccine. And even if we're able to squeeze out one more dose per vial, we still need vials. And so I think that always remains front and center, is we need to do whatever we can to procure more supply.
On the question of whether Canada will end up paying the same amount of money for less product, the government didn't comment by deadline, while Pfizer tells Global News the agreement is based on doses and not vials, and they will fulfill the commitment in line with Health Canada approved labeling. Abigail Bimman, Global News, Ottawa.